Hello everyone, this is the mechanical versus bioprosthetic heart valves debate. I'm Arseni Gabriel.
I'm Desi Ferreira.
I'm Ethan Horner.
So what are heart valves? Heart valves are valves inside of the heart that open and close to regulate the amount of and direction of blood flow. The valves open when there is a positive pressure gradient and close when there's a negative pressure gradient, thus preventing backflow. If the valves do not fully open, a symptom of valvular stenosis, then the heart will have to work harder to maintain the same cardiac output. If the valves do not fully close, a symptom of valvular insufficiency, then the blood will flow backwards through the valve. This also strains the heart and reduces the cardiac output. In the United States alone, there are approximately 100,000 heart valve operations per year due to these diseases. Both of these diseases can be congenital and are caused by excessive wear or fevers. So, types of valves. The main types of valves are artificial devices, autografts, and homografts. Autografts and homografts have limited availability and are associated with further problems. So most valve replacement use artificial valves, like mechanical or bioprosthetic. Both mechanical and bioprosthetic valves rely on pressure gradients to open and close. But their differing composition leads to differing designs. Most mechanical valves are made out of titanium and coated with carbon, whereas bioprosthetic valves are made from animal tissue, primarily pig tissue, and both are surrounded by a ring of knitted fabric that is sewn onto the heart.
The primary advantage of mechanical valves is their structural durability. They can last a lifetime, whereas bioprosthetic valves must be replaced every 10 to 15 years. However, mechanical valves provide a surface in which clots easily form, causing thrombosis. Anticoagulants can be taken to reduce the chance of clotting, but this increases the chance of major bleeding events occurring and does not guarantee that thrombosis will not occur. As mentioned, bioprosthetic valves must be replaced every 10 to 15 years due to structural deterioration. This means that bioprosthetic valves are ideal for elderly people, as young people may have to have their valves replaced several times throughout their life. Scientists are researching designs that increase the durability and ease of replacement of bioprosthetic valves, which would make them more optimal for young ages. While mechanical valves are less likely to require reoperation, they reduce the quality of life of a patient due to labor-intensive monitoring of blood thinners. In addition, the use of blood thinners could turn what would be a small scrape or fall into a major bleeding event that could lead to death. In addition, some patients, such as pregnant women, may not be able to take blood thinners. Therefore, a woman with a mechanical valve will never be able to have a child.
For these reasons, bioprosthetic valves have been becoming more widely used than mechanical valves. This trend is likely to continue as research goes into improving bioprosthetic valve design. For example, bovine valves have recently been found to have significantly better hemodynamic results and lower gradient. This would improve the quality of life of patients and the structural durability of bioprosthetic valves, making them more suited for young people. An additional method of bioprosthetic valve implantation uses transcatheters to minimize the invasiveness of the surgery, thus reducing the operation mortality rate and recovery time. This method is especially ideal for people who cannot undergo open heart surgery due to age or disease. An extension of this method is a valve-in-valve transcatheter replacement, in which a new transcatheter valve replaces a damaged valve without taking it out. An early study has shown that this process has merit. Patients with symptomatic aortic stenosis with congestive heart failure symptoms had a 25% survival rate at 2 years. But with the use of valve-in-valve transcatheter valve replacement, patients had an 87.5% survival rate at 4 years. Long-term data needs to be obtained before this operation becomes a commonplace. In conclusion, patients in need of heart valve replacement should choose to use bioprosthetic valves instead of mechanical valves. Bioprosthetic valves may have to be replaced more often, but they offer an increased quality of life, lower likelihood of major bleeding and thrombosis, and fewer complications involving the surgery and maintenance. Bioprosthetic valves will only improve with time as they become more durable and the replacement process becomes less invasive.